How does a splenectomy affect lymphoma patients? Imagine losing a part of your immune system and wondering how it impacts your health. When someone with non-Hodgkin lymphoma undergoes a splenectomy or removal of the spleen, it can have significant effects on their body. The spleen is a vital organ in the lymphatic system, helping filter blood and fight infections. It also plays a role in managing blood cells, especially during disease. Removing it is sometimes necessary to control symptoms like an enlarged spleen or low blood counts caused by lymphoma. For some patients, a splenectomy can bring relief. It may help reduce symptoms caused by an enlarged spleen, known as splenomegaly, and improve blood cell counts. In fact, many patients see their blood counts return to normal within the first month after surgery. For some, this procedure even leads to long-lasting remission, meaning the disease stays under control without further treatment. The surgical risks are generally manageable, with about a 3% chance of death and a 37% chance of complications like infections or bleeding, depending on individual health. However, removing the spleen comes with important considerations. The biggest concern is the increased risk of serious infections. Without the spleen, patients are more vulnerable to infections like pneumonia, meningitis, and blood infections. These infections can develop quickly and become life-threatening if not treated promptly. A rare but dangerous condition, called overwhelming post-splenectomy infection, can cause rapid deterioration and death if it occurs. Studies show that infection-related complications happen in about 1 in 5 patients who have had their spleen removed. Vaccination against bacteria like pneumococcus, meningococcus, and influenza is crucial. Vaccinated patients tend to have fewer infections afterward, highlighting the importance of proper immunizations. In addition to infections, patients without a spleen are more prone to blood clots, including deep vein thrombosis and pulmonary embolism. The risk of blood clots roughly doubles after splenectomy. Long-term, there is also an increased risk of developing other cancers, including lung, liver, and esophageal cancers, as well as other blood cancers like Hodgkin and non-Hodgkin lymphoma. These risks can persist for many years after the procedure, so ongoing medical surveillance is essential. Living without a spleen requires lifelong management. Patients should stay up to date with vaccinations and be vigilant about infections. Any signs of illness, even minor ones, should prompt immediate medical attention because infections can escalate rapidly. Doctors often recommend additional measures to prevent blood clots and monitor for other health issues. The decision to have a splenectomy is complex and must be made carefully, weighing the benefits of symptom relief and disease control against the increased risks of infection and other complications. Ultimately, many patients can lead normal, healthy lives after splenectomy, provided they follow their healthcare team's advice closely. Regular checkups, vaccinations, and prompt treatment of infections are key. It's important to remember that each person's situation is unique, and decisions about surgery should always be made in partnership with medical professionals who understand the full scope of the individual's health.